Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Linda Hand, the CEO at Prealize Health. How are you today?
I'm great, thank you. It's just before a long weekend, so thank you so much for having me.
I'm excited to have you. Let's dive right into it. We usually keep these short and sweet. Tell us about your background.
Yeah, so 40 years in my career, most of it spent in early days in high tech, so Silicon Valley, building, organizations, technology products for all different types of uh, industries. Got into healthcare and the life sciences clinical trial space about 20 years ago, and built out a company called Decision View, which optimized clinical trials. And then I got into the payer provider space in 2018 when I joined Prealize as the CEO.
And for those of the audience that maybe aren't familiar with Prealize Health, can you talk us through a brief overview of the company?
Sure. So we were founded by two thought leaders, Stanford professors, Dr. Arnie Milstein and Dr. Nigam Shah, basically who were very intrigued by the idea that one could use machine learning and AI to predict who would be getting into medical trouble in the coming year. And so that was the initial IP of the company. When I joined, we literally started to build out the most comprehensive view of an individual, not only in terms of explaining what that rising trajectory was, or what was driving that rising trajectory, but also the non-clinical factors. So what are the social, economic, environmental, behavioral, attitudinal things that really contribute to the trajectory of one's health, so that our customers can connect that to the next best action, the best thing to do to actually change the trajectory of their health, improve outcomes, and literally save money.
And one of the things I was excited about having you on, Linda, to talk about is a few questions around like AI, right? And I think we're at a time right now where I could ask someone probably 80, 90 years old, and they're going to be able to tell me something they heard about AI recently. It seems like everyone is talking about AI more than ever before right now, right? With
Yeah.
ChatGPT and some of the things that Google's doing. Talk me through as it relates to predictive analytics. How is AI and predictive analytics changing the way decisions are made?
So you mentioned, AI is actually everywhere. I mean, it's in how you drive your car, it's in how you shop, it's, suggestions that are made are all kind of underpinned by AI. But I think fundamentally it's forcing healthcare to be more data driven and evidence based. And when I say that, like, when I was started in the clinical trial space, that was all predictive analytics and AI. So I was very early in this space of kind of changing the paradigm from being reactive to proactive. And at the core, like, you can't start that journey without data. You need data that's valid and accessible and useful to whatever you want to predict from. And it needs to be interoperable so that you can exchange data and consume it and communicate it in a number of ways. And so, really having that as the kind of fundamental underpinning, and people are very different stages of their journey on that. Some are still trying to get their data lakes together, and others are very sophisticated. But then, really the first step in that trajectory is to enable kind of automation of human decisions. So those manual processes, making them more efficient, taking the human error out, encoding known patterns, things like that, making things faster. And I think that early threat was, you're taking away my job. But in fact, you're giving you your job to operate more at the top of your license, right? Advancing into better judgment and providing insights that we humans cannot see. I mean, that's where we really accelerate judgment and reasoning and things with AI. And that's literally the sort of stages that we're getting to in using AI for healthcare.
When one of the other things, Linda, I wanted us to be able to dive more into here today was Probably another topic. Maybe not everyone's talking about this as much as some of as like they are with AI. I hear everything about health plans, right? Everyone is talking about something regarding health plans. Talk me through why it's important for health plans to become more proactive.
I think that it really changes their relationship with their members. So, I mean, at a core, a lot of the interactions that health plans have with their members is transactional. It's you're joining the plan, I'm getting you enabled with that, here's your benefits, yes or no, appeals, things like that. Our first use case that we went to market with health plans was in care management. And care management was, very much transactional. So, the reactive, the claim comes through, I see you're in the hospital, let's get you out, or here's your medication that you need. And really fundamentally, AI and these predictive analytics have allowed a health plan to become more proactive. And it opens up their eyes to like not just what is happening today, but where are you going? And so the conversation changes to what's happening with your health. What's blocking you? What's getting in your way? How can I meet you where you are, instead of having you meet me where the health plan is? And we've seen, that it changes how people also view their health and their health plan. I think, member satisfaction goes up, their NPS scores go up. I mean, we've seen significant changes in the health plans that we work with and the care managers. One, they are doing basically more social work than that transactional level, and they love interacting with members that way. They're also getting them to change their behavior. There's a lot of skepticism around whether or not somebody will change their behavior. But in fact, we have time and again results with our customers where the care manager has called right at the moment of impact, right at the best time, where somebody's not in the middle of an episode, they're not in an emergency at that time. It's before that. We're getting them 6 to 12 months ahead of that, and they're willing to stop smoking, to change their weight, to change their behavior, to get on that med and to stay on it. And, we've really seen significant improved outcomes, avoidance of unnecessary medical spend, because they don't end up in the ED. They don't end up in the hospital because you've caught them earlier and they've made some changes in their behavior. So it's really important, I think, if we're ever going to change the trajectory of health, chronic conditions, et cetera, and bend that cost curve, we have to see the future and then, have an obligation to do something about it.
And earlier in the conversation, when we were talking about AI and predictive analytics, I meant to ask you this, so we'll just circle back to it. Talk me through some of the trends you're seeing as it relates to predictive analytics in your industry specifically.
Yeah, I think that more and more companies are becoming more sophisticated in their use of predictive analytics, especially like AI and machine learning, where it's a black box. And so what's been important for us to do is to add all those insights that, as I talked about, 360-degree profile, to give a more comprehensive view around what is driving that and what is going on with that member. There's a lot of chronic condition management companies that are doing fantastic work to deliver more effective care and more cost-effective treatments. And we work with a lot of specialty care management companies that really need these types of insights, not only to treat them more appropriately, but to understand and inform the risk that they're taking, right? Because health plans are struggling quite a bit right now. And anyone who can take the risk and the cost out is going to be a winner. So I see predictive analytics really informing those decisions, who to take risks with, what does that look like, and then how best to manage it. Also in those value-based care arrangements, I know, our fee-for-service sort of incentives really broke during COVID. And I hope that that's been, a catalyst to really move value-based arrangements forward. I hear all the predictions that, in fact, that there is more support for that, but you need to forecast the future to be able to do that. And you really need to, then inform those individual specific management sort of actions that you can take to manage that risk. Um, we get a lot of, you asked about trends, we're very close to Stanford given our roots, and we have a lot of access to early research. And so I get to see a lot of the things that either they're doing in the Clinical Excellence Research Center there or in the bioinformatics lab. And then not just what is the science, but I think the real challenge is how do you roll it out? How do you enable humans to use something like that? And without taking, healthcare is a human based thing. So, how do you not take the human out of it, but support and enable them to make better decisions so that they can see all the things that they can't see? I think for us, up next is really moving to predicting those next best actions. Providing such comprehensive predictions into the health trajectories and the timing of events around individuals so that we can really guide whole person care. And again, I think whole person care is going to be needed in connecting these chronic care, chronic condition management companies together, because I'm a whole person, but I might have 6 comorbidities, and how do I manage it? Which program should I be in? We really need to be looking at the whole individual.
Well, Linda, I want to thank you once again for joining me here on the Slice of Healthcare podcast and telling us about Prealize Health and just giving us some insights on what you think the future of the industry is and talking a little AI as well. So thank you so much. Really appreciate it.